Thanks for joining us today. Welcome to the Center for States video series on the essential functions for monitoring, evaluating, and applying findings. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Monitoring, Evaluating, and Applying Findings brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute strategies to monitor and evaluate implementation efforts and interventions, strategies to collect and analyze data for a variety of evaluation types, and then using data to make decisions and plan for sustainability of programs where feasible. It does this by providing step-by-step guidance to strategize and develop a plan for evaluation, collect and analyze data and consider fidelity and costs, and then use results to make decisions about ongoing efforts and sustainability. The Monitoring, Evaluating, and Applying Findings brief is broken down into 4 parts and 11 essential functions or tasks. It is important to remember that while the steps are presented in a linear way, in practice, often these steps will overlap and be revisited as teams continue to monitor, evaluate, and apply their findings over time. Part 1 is setting the stage and includes considering the circumstances and needs of the agency, developing a logic model, identifying questions, and identifying the data measures, sources, and collection methods that will answer them, and then developing an evaluation plan. Part 2 is collect and analyze data. It includes strategies to put the evaluation plan into place by collecting and analyzing the data outlined, and then 2 special featured topics, a version of data collection and analysis. They are examining fidelity and analyzing costs, which is the topic of this module. Part 3 outlines how to use the data collected to make decisions and adjustments, with 2 functions on sharing findings and recommendations, and then making decisions to further spread, adjust, or discontinue. Then Part 4 is on sustainability planning and how teams should refine and implement a plan to sustain interventions when this is the decision of the team and stakeholder groups. Let's get started. Why do teams analyze costs? A cost analysis estimates the value of resources used to implement an intervention and can support decision-making and allocation of limited child welfare resources. Increasingly, federal agencies and other funders require cost analyses as part of a broader evaluation of the projects they fund. Teams should analyze costs to satisfy requirements of their funding agencies, to support intervention selection and any testing or piloting that is planned, and to intentionally plan for scaling up and achieving sustainability. How do teams analyze costs? One approach, called the ingredient method, itemizes all resources needed to do the required activities and deliver the services for an intervention. These may include costs associated with people, such as salaries and benefits, including direct service staff, supervisors, managers, and administrators. Project costs such as materials, supplies, and equipment, as well as facility space and utilities. Service costs such as transportation for staff or participants, and contracted services with partner providers. And other indirect costs, for example, overhead costs that support delivery of program services that are shared across programs, such as training, accounting, human resources, and information systems. Costs should include not just what the agency pays for, but also the in-kind value of donations and volunteer time. Data may be collected through templates or surveys and can help determine how much of each resource is used for different intervention components. Conducting analyses on the data that is collected on the cost outline can help teams to estimate total program level costs, estimate the costs of specific intervention components or activities, and estimate costs per participant by combining intervention cost data with participation data. Cost analyses can offer valuable insight into the costs of implementing and sustaining an intervention, and if a consistent approach is used throughout the organization, cost analyses can support comparisons across programs. There are also additional analyses that teams can conduct with cost data that combine cost analyses with program outcome studies. For example, a cost effectiveness analysis, which examines the relationship between costs and a unit of program effectiveness. For example, the cost per case of child maltreatment prevented. Cost-benefit analyses. This compares an intervention's costs with its benefits, which are expressed in monetary terms. For example, comparing the costs of a home visiting program with the benefits or the costs avoided through prevention of out-of-home care and trauma-related health care. While an agency can generally conduct program-level cost analyses using available management and accounting systems, it may need more expertise in data collection and analyses for these more complex methods. There are additional tools and resources to support teams in analyzing costs in the Monitoring, Evaluating, and Applying Findings brief. Teams should consider the following key questions when engaging in cost analysis work. What items or ingredients make up the full cost of implementing the intervention? How might true costs differ from the program budget? For example, the inclusion of volunteer hours or shared indirect costs. Which components are using the least or the most resources? Are costs expected to change over time? For example, when piloting, scaling up, or sustaining a widespread implementation effort. Do benefits of the intervention outweigh the costs? And what are the implications of a cost analysis for sustainability? Let's take a moment to check in on what you've learned about analyzing costs. Why do teams analyze costs? To satisfy funding requirements, support decision-making around intervention selection, testing, and piloting, and to plan for scaling up and sustainability. How do teams analyze costs? Teams should include costs and data from a variety of sources as ingredients, including donations and volunteers, and then use various analyses to define the cost of the program, defined activities, or each participant. What can help teams analyze costs? By considering as a team the cost of the elements needed to implement a project, what components are more or less resource heavy, the cost-benefit comparison, and how costs may change over time and impact sustainability. Now take this a step further by reviewing the reflection questions for analyzed costs in your Monitoring, Evaluating, and Applying Findings workbook to connect what you've learned to your own experience. Up next is Share Findings and Recommendations, the 10th module in this series, and the first essential function in Part 3 on using data to make decisions and adjustments.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.